welcome to Your Personal Health. I'm Jeff Harrison, and I'd like to welcome to our program Dr. Michael Kim and Dr. Krista Burris. Hello, doctors. How are you today?
Hi, we're doing good.
Hey, it looks like we need to edit that name. Looks like you guys are using one studio instead of two different locations, so we need to make sure I'll edit that out. But in the meantime, tell us what's been going on. We've had we're going through some really big changes weather-wise here in the Coachella Valley. We finally see what I think have been called snowbirds. We start to see fewer of them, but we're also seeing a new level of permanent residents here in the Coachella Valley. So take a second, talk about that, and how does this figure into our personal health when we have this COVID thing still going on, even though it looks like it's almost over? It's maybe not over yet. So can you tell us a little bit about that?
So, as we go about our life in the Coachella Valley, it's always interesting to see the changes with the seasons. And as I've been sort of out and about, I've seen less of some of our snowbirds, but this year we had less overall, it seemed like, that were here. But I've seen a large increase of people from other Southern California areas, specifically the LA area, who've come out and maybe during COVID did some long-term rentals or decided to move out here permanently and work remotely or go in maybe once a week to the office. So I'm seeing that kind of trend growing where we have people who used to be maybe more coastal and now have come out to the desert. Have you noticed anything like that?
Well, it feels still busier. I know that probably less snowbirds have come down, but it seems like the ones that did stayed longer, and it seems like you're saying that the people that usually don't come here often are staying here longer, because it does feel like it's just busier. It's less now than it's reached, triple digit, but
yeah, we'll see if this week dissuades some of them from summer residence. So we'll see.
True. It's as I look out the window, and I think it's about 110 out there today. A little cooler than I think they expected because of the overcast. But the humidity is a little higher. But
Right.
What I'm concerned about is already here in the Coachella Valley, and we've talked about this before, the pressure on trying to find a primary care physician when there's already a strain because there's a lack of primary care physicians here in the valley. When we think about the people that are moving out here, we think right now, a lot of people are moving out here and saying, hey, I want to get out of the city. I want to get out of LA. I want to get out of San Francisco, Seattle, wherever it may be, where there's a high rise and a congestion. And they're bringing younger families. So with that, I mean, I remember as a kid, it's like, hey, Dr. Brown was my guy, right? I mean, it's like he was our doctor. And what do you see as that? Do you think that will start making more doctors as they graduate to become primary care physicians, or is there really a shift that needs to happen?
Unfortunately, we're still seeing doctors coming out of training, sort of moving away from primary care. That's a trend that's been going on for at least 20 years, maybe longer, 30 maybe. And we had sort of a heyday of primary care training in the 1970s and 80s. And then since then, we've seen more and more doctors going into specialties instead. And even doctors who initially trained as primary care doctors will then sometimes later in their careers leave primary care and take a different type of job. So overall, that pressure is not being met by a reciprocal supply of primary care folk. So unfortunately, I think we've seen through the last year a decrease in the actual number of available primary care doctors here in the Coachella Valley. And we're still seeing an net increase of people moving into the valley who are looking for that or who need it, and maybe developing some kind of patchwork system. You mentioned San Francisco. We've seen quite a few people who have a primary care doctor up in San Francisco, but of course, just going in to see them when they're ill is impossible if they're living here. But it's too hard to get a doctor here, so they basically rely on that doctor and fly back there once a year just to get a checkup. That's not ideal for people's health, honestly.
How aware do you think people are of Coachella Valley Direct Primary Care? Because your setup is much different. I think of how you've educated me through our shows over the last 15 months, 16 months, of how many people are actually seen by a primary care physician when they're in the system. And correct me if I'm wrong, but it's like it could be like 2, 3, 4,000 people. Is that correct?
Yeah, that's correct. In a normal, busy primary care practice, you can have anywhere from 2 to 4,000, and depending on whether you're a large group or a smaller group, some of those smaller groups will filter who they're seeing based on who pays the best. So if Medicare is paying better, then they'll start seeing more Medicare. If Medicare is not paying better, then they'll start seeing more people. And there's some primary care doctors out there that says, we will not see these insurances because they don't pay enough. We only will see these insurances. And so, that you throw that in the mix and it just gets more complicated.
So I'm curious now. So let's say, for instance, somebody comes to the desert and they get on an HMO or a PPO, but maybe an HMO. Are they guaranteed to be able to get into one of these doctors now because they're in the umbrella of an HMO system? Or is it the fact that, hey, you know what, their doctors are maxed out at 4,000 patients and there's just no room. There's 5 gallons of water in that 5-gallon bucket.
There is a law, there is some legal protection for people. So if they have a health insurance plan, that insurance plan is required to provide them a primary care doctor that's within 30 miles of their home or workplace. So there's a law that says that. But just because you're on a panel or you're assigned to a doctor doesn't mean that you have good access to that doctor. So if that doctor, for instance, is scheduling out 2 months, that's kind of what you're stuck with.
What do you see right now, if you could kind of open up your crystal ball, and if somebody had to get to a doctor, what kind of a wait time are we looking at now for primary care, not specialists, but primary care physicians right now as a general rule here in the Coachella Valley? Do you have a feel for that?
I do. It's a number that's just a ballpark, because sometimes people will get lucky and get a cancellation, or other times a doctor will have an abnormally long wait, either because they're on vacation or something like that. But I'm seeing the 2 to 4 week mark.
Wow.
Is about average. And again, it depends on the popularity of the doctor. And that's if they're accepting new patients. I think what we see more and more is just doctors who aren't accepting new patients at all.
Wow. So let's talk about the alternative with Coachella Valley Direct Primary Care, because you're different, and in many ways. Can you just explain how the normal system, what we're used to, and how you said, hey, we're going to do something different, and this is what it looks like?
Yeah, so we believe insurance is good. It has a good function, but it starts to break down when it's being used for the wrong thing. And by that we mean, if you for instance take your car, everyone is required to have auto insurance. But I can't drive into Goodyear and say, hey, here's my State Farm or my Farmers, I want my tires rotated, and I want new back tires, and I want an oil change. They would say, great, this is the cash price, and if I don't like it, I could go somewhere else. And that kind of allows the market forces to be for those things to occur. But if I total my car, that's a little harder to pay for, and that's what insurance is good for, just like your home insurance. And so health insurance should be there for things that might hurt more in terms of the pocketbook. And so that doesn't exist in this current system. It's an all or none system. So because of that, it is so high. I mean, people pay thousands of dollars for their family and even for themselves. And so what the primary care physicians have done is said, hey, why do we need to participate in that kind of a system? Why can't we get out of that system and have an affordable way where people can have good access to primary care, where we're not running 40 or 50 people a day in our clinic, because that's what it takes to keep the overhead. It's a much slower pace where we can see people for an hour, 2 hours if we need to. We are able to talk to people, get them in same day or next day, and we don't charge people for this or that. It's all just a predictable fee.
How is that possible? How are you able to get people in as much as same day and spend that kind of time with them, when people that are just like you, they're primary care physicians, they're seeing 100, I don't know, 100 people a day? Is that
some specialists are some, yeah, but
yeah,
not.
I would say the average primary care doctor probably sees between 20 and 40 a day. So it depends on the type of practice they run, but that's pretty average. We really average. Our goal is to see in the office about 5 to 7 patients a day, and we're able to spend time with them and then manage the other things through other means, such as text or video chat. There are a lot of things that we do in the old-fashioned insurance-based system that are only for billing purposes. So bringing people in for everything is the only way a doctor can get actually paid for doing that work. So if you spend a half an hour on the phone with a patient and go through everything you wanted to take care of, and you really didn't need to do a physical exam, you would get $0 under the old insurance plan. So because of that, it really disincentivized doctors to take care of things in any other way. Now, with a little more acceptance of telemedicine, I'm hoping that the whole system will maybe loosen up a bit and help us poor primary care doctors out a bit to take care of things in the way that makes sense for the patient and their issue. But that is part of the problem. It's only part, but also the amount of reimbursement that doctors would get for a primary care level service was so low that they had to, in order to break even, see these higher and higher numbers of people.
I was talking to a friend of mine who's an obstetrician, and he says Medi-Cal pays him when he sees his OBGYN, his pregnant patients. I think he gets reimbursed $30 to see someone, and it takes him about anywhere from half an hour to an hour sometimes. Wow. So he's losing money by seeing.
So that system's broken because we know that the people paying into the system are paying much more money than that. So the money's going somewhere, but it wasn't going to the actual people providing the services. And so we carved out the primary care portion and said, okay, what's reasonable price here for what we're doing and for what people are getting? And we can just have a direct relationship with our patients, and they join the practice as a member, and then we don't have to carry 3,000 patients. We can carry a few hundred and have a lot more time to spend with them and provide, we hope, much more personalized and timely care. And that should result in people having a better experience, getting better care, and ending up healthier and having their family healthier with less stress.
Well, I mean, who wouldn't want that for themselves, whether it's an older population with no children or a family? Who wouldn't want this kind of care? Is it the fact that they just don't know about it and they think, hey, that's the way it's always been, that's the way it's always going to be, and so they just plug in and kind of deal with it? It's going to be 2 weeks or 4 weeks, or it's going to be a long wait when you get in the office. Do you think we just don't know about this, about what you're doing?
I think so. I think it's um, a lack of awareness, because this system's been in existence for I don't know, 30 years, 40 years, in some fashion. And so everyone, even from the doctors all the way to the patients, are used to this system. And it's just, this is how it is. This is the way it is. And so it's I think, lack of knowing that there are different alternatives out there.
Yeah, and I honestly think people are like, sometimes they come in and they talk to us and they're like, well, I'll try this. I'm not really sure that I know if this is going to work or not. Or they may not see it as a value to themselves because they've been so trained by the system to not use the medical system that they don't realize that there are opportunities for them to improve the quality of their health that they're not taking advantage of, because as a system, we've been trying to push people to not use it as much as possible.
Right.
So we're not really getting the benefit of what our modern technology and health system can offer to people.
I think you and I talked about this a couple shows ago, Jeff, where I don't mind paying my AAA, because especially now when it's triple digit, if I can't take care of my car, I'm calling AAA and they're going to be there. And right, if I can't imagine if they're like, hey, 2 weeks, I'll be there, and I'll be like, hey, no worries, I'll be here.
Sitting on the side of the road.
But that's kind of how most people right do healthcare. And it's something that they could come take care of it. I mean, we had a flat tire, the lug wrench just wouldn't fit the nut, so they came and they used their multi dimension lug nut, and we got the spare tire on, and I was able to go and get the tire repaired. And so I think we don't have the same idea about healthcare. We always think, oh, it's only good when I want to use it, versus no, there's a lot of things that can be prevented, but there's also things that, boy, it'd just be easier if you could take care of it right away rather than going to the ER or the urgent care.
Or the system punishes you for using it by a huge copay or like a bill you weren't expecting. And so it sort of trains you not to take care of things when they're small. It's like, well, I didn't want to go see my doctor because I wasn't coughing up a lung yet. It was only blood, And so that mentality, I'm kind of joking, but it's true. People are like, well, it wasn't that bad, so I didn't want to come in, until my chest pain got to the point where I couldn't do like my normal activities. So these are things that put people's lives at risk. But even small things like a little urinary tract infection, if left untreated for a week or two, can turn into sepsis and land somebody in the hospital. So these are things that, I've seen happen over and over again because people delayed care for whatever reason. Whether they couldn't get in, they didn't have insurance, they were scared of doctors. There's a lot of reasons.
Yeah, and I just read somewhere that one of the large insurance companies, they're going to start looking at all the ER visits, and if it wasn't a true emergency, they're not going to cover it anymore. And so the ER system is saying, well, how do people know whether it's an emergency until they come in? And so now you're going to have people going, well, my arm is not completely off, so I guess I'm not coming in, versus, hey, the system is just designed poorly and let's redesign it. So I think what you said, Dr. Burris, is going to start happening, because people aren't going to want to get dinged for things that aren't emergencies that they don't know.
And we already struggle, especially with our stroke patients, at getting them to come in as fast as possible, because we only have 2 hours to reverse that blood clot in the brain and save that section of the brain. So if somebody even sits around for an hour seeing if their arm will start working again, that might make the difference of getting that arm working again. So it is something that really stresses me out. I actually had a patient once drive by 6 hospitals having a massive heart attack to go to the hospital that he knew was in his network. And he could have easily died. He could have easily taken out other people on the freeway. I mean, our mentality is so ingrained by the system we have that's really not set up for our health. It's really set up for somebody to make money, but I'm not sure who.
Yeah, we have a member who, everyone knows, stroke symptoms and heart attack symptoms, and that person was having some chest pain, but continued to work. But they decided, hey, let me called us. We called them back right away. We told them, hey, with your XYZ risk factors, you got to go. And that night, that person had bypass surgery. And the surgeon was amazed that he was doing so well. But at any second, and who knows how long, has been a ticking time bomb. And so, being able to have access to someone that can say, hey, this is reasonable to go. Oh, hey, no, we can take care of that, or you can wait, I think is valuable.
So let's just kind of put a bow on this, because first of all, we think of what you're offering as almost like concierge doctor service. And when we hear that word concierge, we think expensive, because we've all seen the shows in private, whatever. But actually, as we see scroll along the screen, if you're 45 years or younger, it's only $99 a month. And then if you're 46 until you pass away, it's only $145 a month. Tell us what that gets us, because is there still a is there still a deductible when I come in? Is there a copay when I come in? Tell us a little bit about that.
So there's no copays. That membership price covers your primary care for that month. So no matter how many times you call us, no matter how many times you need to come in, no matter how many times we need to take a look at something in the office, it's covered for that month under that one price. The only things that we charge for are the things that happen outside our office that we don't control. So that would include things like lab tests or radiology tests. But we've also done our very best to get people very reasonable prices for those things, and also pass along that price to them. We're not interested in tacking on a fee to profit off of that test. So we'll find the most affordable way to get what that patient needs, let them know the price, and they can know upfront exactly if there's going to be an extra price, what it is, before they go that route. And they can choose not to do it. I mean, that's what I feel is so problematic in the current system, is it's so non-transparent that you have no idea what anything is going to cost you and until you get that bill.
Very expensive.
Yes. And if you ask the doctor, well, how much will this cost? They'll say, I have no idea, because they don't.
Wow.
The thing we wanted to say is that even though we say, insurance has its place, you can have insurance, you don't have to have insurance. So at our clinic, we don't turn anyone away. If you don't have insurance, we have made these arrangements where there's low cost radiology and labs. And if we need other things, we'll find the lowest price and let people know. If you do have insurance, we will use your insurance and let you know, hey, it's probably a good idea to use your insurance this way. Or for labs, if the lab is a $10 test, for me, I would say, you know what, just charge me the $10. I don't want to use my insurance. It's probably going to be more expensive.
Yeah, some people have a $20 copay at the lab. So just doing it through us for $10 actually saves them money. So sometimes we learn as we go with our members, which of our members have the higher copays, so that we can sort of take a look at their labs and do the way that makes the most sense for them.
Well, I'm going to put on screen now here along the bottom just on how to get a hold of you, because this is an alternative that actually is a very good alternative. Because you've told us in the past in other shows that even if you have insurance and you went with your program, the chances are you could probably adjust some of your paid insurance to offset my membership fee. Is that correct?
Often people can. They'll take a look at their options and realize that for what we're going to provide for them, it's going to allow them to have one of the cheaper plans, because we're actually providing a lot of the services that they were paying more for a higher plan. So just having that access to a doctor, having the ability to take care of things without copays, etc. It allows them to have a higher deductible plan that they never really even use unless there's an emergency or a catastrophic event.
Wow.
And right, and then I often tell people, if you had a Lexus and you parked it in a parking garage, but you could never get it when you wanted it or use it, then you might as well have a Yugo or a Honda, because
there's nothing wrong with a Honda or a Yugo.
No, there isn't. but if you can never use it, then why pay for the more expensive portion of it? And so it's really also about access and how much you're treated as a person versus not. So,
well, let me just find out, because of this whole thing of the up to 4,000 people in a panel, do you have room in your clinic, in your membership program, for more people? Like if somebody said, hey, I'm looking for a primary care physician for myself or my wife and I or my family, are you taking new patients?
Yes, right now we definitely are taking new patients. And so if you know of someone who's looking for a doctor, our clinic is accepting them at this point. So we do encourage people to give us a call, and we should be able to arrange free consultation so they can learn more about us and see if it's going to work for them.
Now, if you're interested in this, there's a number along the bottom there, 760-642-5549, and just call that number. And just like Dr. Burris said, there's a free consultation and a get to know you. And I know as patients and members of them, and my wife, I know when my wife first signed up for this, and it was all it was like a Zoom call. My wife was like, wow, she was so impressed because of the fact that you actually spent some time with her to get to know her, that it was like, these guys are amazing. Like, I think you spent like an hour and a half with her and getting to know her and her background. And she was just overwhelmed by that in a very positive way. So if you're looking for, somebody to take care of you and your family, and it's not just in an emergency, but really helping you with your family and their lifestyle and their health, boy, this is a great alternative. It's Coachella Valley Direct Primary Care. You can go to CoachellaValleyDPC.com or 760-642-5549 and call them, make an appointment, find out. It's free. The difference is you're not going to have to wait 2 weeks to get to see them or to talk to them. You can pick up the phone and call 760-642-5549 today and start taking care of yourself. Don't put off that sore arm. Don't put off the urinary tract infection. And next thing you know, you wake up and you're in the hospital. It's not necessary. There are better alternatives. And it's Coachella Valley Direct Primary Care. Guys, thank you so much for being here. I really appreciate it. I know you give a lot to the community, and we just want to say thank you so much. And if you didn't catch it, they also do a show prior to this. It starts at 3, and it keeps us on top of what's going on with COVID. I know it seems like COVID is over. Everything has changed. But I got to tell you, what we found out in the last show today, it may not be over. So still be cautionary out there. And if you missed it, go back and check it out. It started at 3:00 today. And if you have questions in there, Dr. Kim said, hey, put questions in there, and they'll be more than happy to follow up on that. So guys, thank you so much.
Thank you, Jeff. And we just want to let everyone know, just stay well hydrated. It is hot out there. We don't want you to get in trouble.
That it is. Guys, take care, and we will see you next week on Your Personal Health.